Anxiety disorders and depression are the most common in childhood and adolescence. Well, anxiety and depression get talked about together because they often occur together and they have some overlap, especially in kids and teens. In children and teens, they'll often have components of both, or the way that anxiety and depression gets demonstrated in children and teens can look a lot the same, because it can be things like irritability, physical complaints, headaches, stomach aches, anger, moodiness, temper tantrums, things like that. In teens, it can be kind of isolating themselves or withdrawing. So a lot of the behaviors kind of have a lot of overlap. They can be indicative of anxiety or depression. It's not just people think of anxiety as outright worries and fears, which it can be. They think of depression as someone who's sad and crying, which it can be, but it can also be all these other kinds of behaviors. It does depend on the disorder for sure. You know, with the most common ones, so with ADHD, it is that really high activity level, a lot of trouble paying attention, real impulsivity, acting without thinking. But again, all little kids are like that. So it's when it's way beyond what's typical for their age and when it's getting in the way. With things like anxiety and depression, like I said, it's sometimes overt, it's in your face. They're unhappy, they're scared, they're refusing to go to school because they're so worried. They particularly feel fearful of social situations and they won't go, they won't do things, they won't engage in things. But like I said, in kids and adolescents, the tricky part is really watching for those subtle indications that do get mistaken for, oh, it's just behavior. He's just an obnoxious teen. He's just behaving badly, when there could be something more to it. So it's watching for those other things that can indicate, and watching for in teens things like they may turn to drug and alcohol use, not just because they're being rebellious, but because they're trying to cope with something. So it's really knowing, it's having adults who know the child or the teen well, so they can tell when something is out of character or when something is changing, and gathering more information and taking a closer look.